All right. Hi, everybody. My name is Megan Murphy, and I did my final research project on multiple sclerosis. Um, I just really quickly want to point out on this title page, on this quote here, I really liked it. It says, it takes up to 5 more times energy for a person with MS to complete even the most simple task than it does for a person without MS." And I think that's a pretty outstanding quote that kind of sums up or just describes how severe MS can be and how important it is to kind of understand this disease. So I'm glad I am able to educate the people in this class on multiple sclerosis. All right, here we go. So what is multiple sclerosis? It's also called MS, so I'm just going to refer to it as MS. But MS is a disease that impacts the central nervous system and specifically the myelin that surrounds axons. So it's kind of up in the air or questionable whether or not it can be referred to as an autoimmune disease. Some scientists say yes, some say no. So I'm just going to kind of explain to you that um, in a person with MS, they have an abnormal immune response that causes their own immune system to attack their brain and spinal cord. And that kind of produces an inflammation and a degeneration of their myelin sheaths on their neurons or on their axons to be more specific. So the exact cause or the trigger of MS is relatively unknown, but I did like this quote from one of the papers I studied, and it says that epidemiology of MS indicates that low serum levels of vitamin D, smoking, childhood obesity, and infection with the Epstein-Barr virus, which causes mono, are likely to play a role in disease development. And I thought that that was pretty interesting, kind of indicating that developing MS is kind of environmentally related or kind of to your surroundings and things like that. Just some other facts about it: women are 4 times more likely to develop MS than men. So there are many more women in the world who have been diagnosed, unfortunately, with MS. And overall, your chances of developing MS are pretty rare. Around approximately 2.8 million people in this world are living with MS. However, it's pretty unfortunate that it's becoming far more prevalent. I'd say around 1 million people in the United States live with it every day. But scientists and researchers are seeing a big jump in diagnoses of MS, and more people are coming down with multiple sclerosis. All right, so here's just a quick refresh of neuroanatomy. So what is myelin? Myelin is an insulating layer made of proteins and fatty substances that surrounds the axons of the central and the peripheral nervous systems, as we learned about previously. In the central nervous system, so your myelin is going to be made from the oligodendrocyte, which is a glial cell of the central nervous system that makes the myelin, whereas in your peripheral nervous system, myelin is going to be made by the Schwann cells. However, um, the multiple sclerosis really only impacts your central nervous system, which is why it's important to know what cells are kind of degenerating and where the myelin is coming from. So overall, the function of myelin is going to allow for quick and efficient transmission of electrical impulses. So kind of the action potential from the axon hillock down through the axon to the next neuron and such like that. And it kind of can provide a layer of insulation and protection as well. So I really like the image to the right that shows the the two neurons together next to each other. One is unmyelinated on the left, and the next one is myelinated, and it shows you this depiction of an electrical current, let's just say, impulse flowing down both of them, and that you can see in the myelinated one, it's going down a lot quicker and more efficiently. So I thought that was pretty cool. All right, so what causes multiple sclerosis? Um, the ultimate cause of MS is relatively unknown. There are a lot of hypotheses and ongoing research to help identify the triggers of it or where it comes from, but some current ideas are the immune system function, so whether or not you have a healthy functioning, properly functioning immune system, and whether or not that can kind of trigger your body to start attacking your brain and your spinal cord and the myelin, and then you have this degenerative uh, neuromusculo kind of multiple sclerosis. So that's kind of scary. Vitamin D levels, the amount of sun exposure, they're predicting that if one person is exposed to vitamin D more so compared to another one, that they may have a decreased chance of developing MS. So if you go down my list here, latitude, the closer that you are to the equator and things like that, the more sun you're exposed to, your chances of developing MS decrease. Of course, genetic mutations, whether or not, family history, did somebody else in your family ever have MS, things like that, exposure to viruses like the Epstein-Barr virus, mono, sex, so are you a man, are you a woman? If you're a biological woman, you are definitely more likely to develop MS than a biological man. Smoking, childhood obesity, other environmental risk factors that may put you at a higher risk of developing MS and things like that. All right, so here are some symptoms of multiple sclerosis, common and rare. Some of the common symptoms are vision problems, changes in gait, loss of coordination or balance, tingling, numbness in extremities in your limbs and your arms and legs. Of course, some pain, bowel issues and bladder issues, so maybe incontinence or diarrhea, things like that, fatigue, sexual problems, emotional changes, and things like that. I think those are pretty interesting problems. Unfortunately, symptoms of multiple sclerosis are very, very similar to other diseases and other problems and things like that. So diagnosing multiple sclerosis is pretty difficult, and oftentimes people are misdiagnosed or given the wrong diagnosis because just symptoms are very similar to other diseases. However, some of the rare symptoms include acute pain in a localized area, loss of taste and smell, trigeminal neuralgia, itching, seizures, tremor, hearing loss, difficulty swallowing, and walking without assistance, slurred speech. I do want to note that many times, because MS is affecting your brain and spinal cord, many people who have have further progression in their disease, so they've had MS for a while, may experience difficulty walking, and they may need a wheelchair, a cane, assistance, a walker, things like that. So this difficulty walking isn't necessarily rare in those with MS. However, for it to come on pretty quickly, like a first symptom, to be a first symptom of your multiple sclerosis, I'd say it's pretty rare for you to not be able to walk right away. All right, so here we have the types of MS. There are 4 types of multiple sclerosis. And I also think it's pretty important to note that multiple sclerosis greatly varies from patient to patient. So each person is not going to have the same type or necessarily the same symptoms of MS, and each case of MS looks different. So starting with the clinically isolated syndrome, it's characterized as the first episode of MS symptoms and does not always develop. So somebody who's diagnosed with a clinically isolated syndrome, um, they may or may not get MS. So I think that's pretty interesting, and they may just have this one syndrome and keep it like that, or it may develop further symptoms that are pretty similar and indicate that this person has developed multiple sclerosis. All right, so the most common type of MS is the relapsing remitting MS, and it's where patients experience flare-ups of disease followed by a remission period. So as you see by the little graph I have on the right side of the screen, it kind of shows that over time, these people have relapses and kind of remissions of the disease, and how their level of disability unfortunately decreases over time, and it may worsen, their symptoms may worsen, or they may stay pretty consistent. But I thought that was pretty interesting, seeing as though around 85% of people have at least one time in their diagnosis they've been diagnosed with RRMS. All right, then we have the primary progressive MS, where symptoms slowly worsen over time with no relapse or no remission period. And these people tend to develop more spine lesions. So typically in people who are diagnosed with MS, they have, physicians and researchers, scientists, what may have you, takes MRIs of their brain and spine, and oftentimes there's lesions along their central nervous system. However, in the PPMS, these patients are having more spinal lesions, which is pretty interesting. And then we have the secondary progressive MS, where patients who usually are initially diagnosed with RRMS usually progress into the SPMS, the secondary progressive, where their symptoms typically worsen with no stages of remission. So they're relapsing more often and they're not seeing much of a relief or remission period where symptoms may tend to stay pretty consistent or go away. That tends to not happen anymore. And these people also tend to see an accumulation of nerve damage and things like that. So this I'd say as time goes on in patients with MS, they typically are seeing worsening of symptoms, unfortunately. All right, so I'm just going to go over RRMS a little bit more just because it is so common, at least in people diagnosed with MS. So approximately 85% of MS patients are initially diagnosed, and over time, like I have said previously, they go through these periods of relapsing where symptoms tend to worsen or new symptoms appear, and they just kind of have a flare up, if you will. And then they may cause an increase in level of disability, but then they kind of go through a level of remitting where symptoms seem to disappear, stay consistent, and they're not really experiencing any new problems. So that kind of goes on for a while. Typically, as you can see by the last bullet point, it can the RRMS tends to happen for around 10 years and tends to get worse for a while, and then the SPMS comes into play, and that's when these symptoms usually develop. So brain lesions tend to develop, seen more so in people with RRMS and brain. Um, these people, as you can see by the MRI image on the left, you can see the brain lesions, and like I said, in the primary progressive MS, people have far more spinal lesions, and then in RRMS, there are far more brain lesions. So I think that these are some interesting facts to point out. All right, so here are some diagnostic and tools and about diagnosis of multiple sclerosis. The most important thing is for physicians and scientists to take a careful history and gathering of information about your family history, your environmental exposure, history of other illnesses, and noting places of travel. I'd say it's important in identifying MS. So typically, your physician, if you're developing symptoms or feel as though you have symptoms of multiple sclerosis, are going to ask you, has anybody else in your family been diagnosed with MS? Maybe they'll study your vitamin D levels and maybe take a blood test and things like that. They'll study, oh, have you ever had mono? Have you ever been exposed to Epstein-Barr virus and things like that? So that's a pretty good indication and gives the physician a pretty good idea of whether or not MS would be a correct diagnosis. And then, of course, a neurological exam would include things like testing cranial nerve sensation, reflexes, walking, balance, and coordination, things that, your symptoms and MS would affect these certain everyday things that you have and take for granted. So overall, if your physician is able to take a detailed history and they perform a comprehensive neurological exam, those two tests by themselves are usually enough to able to meet the diagnostic criteria. So just by doing two of those things, they are usually able to tell whether or not you have multiple sclerosis. But it's always good for them to take a blood test and things like that. They may do MRI imaging to rule out other diseases and do a blood test, a full blood panel to see is there any other thing that could cause your symptoms, seeing as though so many symptoms of other diseases are also similar to the symptoms of multiple sclerosis. So that's pretty interesting. All right, as for treatment management, unfortunately, there's no cure for multiple sclerosis. So if you're diagnosed with MS and it's a correct diagnosis, unfortunately, you're probably going to have to live with that and manage it and treat it your entire life. It doesn't quite go away. But good news is that there are ways to mitigate and treat symptoms. So the symptoms, of course, do range from mild to severe, as no two cases of MS are exactly the same. So the most effective way for a patient to feel relief is just to treat these symptoms as like you would with a cold, for instance, by taking NyQuil. So, I mean, that's the kind of downplayed version of it. But for those people with RRMS, steroid medicine is actually used pretty frequently to treat symptoms. So steroids act as an anti-inflammatory, like methylprednisolone, so Sulamedrol. You've probably heard that on TV or things like that. And it's administered through an IV for about 30 to 45 minutes, and it's usually covered by insurance. And it makes sense for them to be using an anti-inflammatory, seeing as though you're having this abnormal immune response, and your immune response or your immune system is tricked into thinking that your spine and brain and your central nervous system is the bad guy and it's attacking it, creating this inflammatory response. So this, steroid will be able to calm everything down and just kind of hopefully help to alleviate some symptoms. Some more, like, I would say, complex treatments that are coming, being researched in clinical trials and things like that are called disease modifying therapies. And they're proving to help reduce clinical relapses and reduce the amount of the MRI lesions seen in MS patients. So here's a quote from one of the papers I studied. It said, efficacy rates of current DMTs defined by reduction in analyzed relapse rates compared with placebo or active comparators range from 29 to 68%. So this is basically saying that for patients who were administered the DMTs, they saw a lot less of a relapsing, so they didn't really see those flare-ups as much as compared to somebody who was given the placebo. So I think that's pretty great and pretty great, progress into this research. So it's looking promising. These DMTs are in helping treat and alleviate symptoms of multiple sclerosis. There, of course, are some adverse effects and symptoms, as you see on commercials every day on TV, with them listing off, 100 different side effects that you can have from these medications. But as of now, this research is looking pretty promising in helping people with multiple sclerosis. All right, so people living, with MS, they have to find ways to help alleviate their symptoms and just have to find a way to, I think, in my opinion, stay optimistic, because it can be such a devastating disease. And it really does impact their daily life and their movement and their mood. And it's unfortunately a lot of people who have been diagnosed with MS deal also with depression, and and anxiety and things like that. And so, um, according to MS Society, there's a lot of different ways to help manage this. For instance, healthy diet and daily exercise, stress management, cognitive health management, like kind of like a brain HQ, kind of keeping their brain going and doing things like puzzles or coloring books or something just to kind of keep their mind occupied. Actively participating in friendships and meaningful relationships, whether that's like being intimate or seeing an old friend or a parent or whatever. You know, just just trying to live a normal life is super important to them. Managing, of course, managing symptoms and keeping up with their care, going to the doctor, the physician, making sure that they're doing everything they can to stay healthy and stay on top of their multiple sclerosis is very important. And checking in on their mental health, possibly antidepressants if needed. I have this book on to the right that says yoga and multiple sclerosis, which I think is pretty cool. It shows somebody in a wheelchair, anybody with this disability or with this disease, and they've been disabled because of it. They're able to help themselves, and it just kind of shows that you can do yoga, and that helps with your, of course, your physical health, or that helps with, exercise, and maybe clears your mind and the endorphins and everything. So I do think it's very important that people with multiple sclerosis are supported, and they are, given support and knowledge that they are still able to do normal things and daily activities, and that they can live a pretty normal life. All right, so March is MS Awareness Month, and I believe that there's a certain week in March that the MS Society, maybe they have like a run, kind of like October is Breast Cancer Awareness Month. One thing I want to point out that I think is super cool is you can see in the image of the multiple sclerosis, it shows the butterfly. They did that because an MRI scan, usually like the brain resembles a butterfly, or a butterfly looks like the brain, vice versa, and things like that. So, which is why they chose the butterfly. And other images of this, they're shown as like different colors, that also represents that each case of MS is pretty different. And I think that's also really cool. So, orange is their ribbon for MS. March is a month of MS Awareness Month, and it's when several organizations help to educate and bring awareness and attention to this condition and help educate the public. It also, the MS Society encourages both caregivers and patients of MS to take care of their own health and well-being, as well as organizing support groups to help meet the needs of caregivers, because, if your loved one has been diagnosed with MS, it's of course it's very hard on them and they're, navigating this, but you're also navigating this disease as well and trying to take care of them to the best of your ability, and it can just really be difficult on both people. So I think that's really great that they're aware of that and that they're doing their best to help both the patient and the caregiver. All right, and then here are just some sources and citations of the papers that I read to educate myself on multiple sclerosis. I really hope you guys enjoyed and were educated on MS, and I really think that it's a pretty devastating disease and diagnosis, and that um, impacts just so many people and is going to continue to impact so many people daily and throughout the world. And so, yeah, I just think it's really important that you educate yourself on this disease, and I'm really glad that I had the opportunity to do so. So, thank you so much for listening, and I hope everybody has a great winter break. Thanks. Bye bye.